and welcome again to InjuryGuru.com. This is the fifth exercise and fifth video in the knee replacement exercise program number 2. This exercise is called a single leg side reach, and that'll make more sense to you in a minute when I show you. This is another one of my favorite exercises, and it's because it kills two birds with one stone. It works on your strength and your balance, so you gotta love that. And most of my patients really do enjoy doing this exercise, so let me show you the single leg side reach. This is the starting position for this single leg side reach, and it's named really for what I'm showing. So I'm standing on one leg, and my good leg is going to be reaching out to the side. So when you do this exercise, when you first try this, I want you to make sure you do this next to your kitchen counter or your kitchen table, just until you know what your balance is like. You do have to have pretty good balance to do this exercise. And I also don't want you doing this one if it's causing pain in that knee that's not tolerable. So you got to make sure that this one's comfortable. If not, when you first try this one, then just make sure you do all the other exercises in this program, and in another few days or even in a week, try this exercise again. If it's tolerable at that point, then make sure you add this one to your program. So again, standing on my operated leg, so you standing on your operated leg, your good leg is just going to reach to the side like that. So that's really all it looks like. But since we're not in the same room and I can't nag you, I am going to show you from the side as well as and give you just a couple rules. So when you reach with that good leg, you want to make sure that that leg is and that foot is staying as close to the ground as possible the whole time you're reaching, because then I know that your operated knee is bending and straightening like I need it to. Let me just show you from the side so you can get a side view. So as I reach with my good leg to the side, my operated knee is bending and straightening. And that's the most important part of this movement. When you do reach, you want to make sure that you're not losing your balance every time. If you occasionally have to touch your foot down there for balance, that's fine. That's perfectly normal. But every time you come back to this starting position, you can touch your foot down there for some balance, so regain your balance, and go again. And remember, if you are losing your balance every time, you're just going too far, so just shorten that reach a little bit. And also, I'm not touching my foot here, but I do touch my toes down here for some balance every time I come back to that starting position. For this exercise, you're going to do 3 sets of 10 to 15 repetitions. And when you first get started, you might feel some good fatigue, muscle burn, muscle fatigue in the front of that thigh, the back of the thigh, even into the glute region or the rear end. And if you're feeling that, then you know you're doing it right. And I just want to make sure that you are not exercising or doing this exercise if it's causing some knee pain. So any knee pain that's not very tolerable. I also want you to do this one once a day and twice a day if you can get it in.